we see that some infants have an abnormal head shape. Some are noticed immediately at birth, and some are seen to develop over the first month of life. This can be like a flatness in the back of the head, or just an asymmetry, or rarely associated with changes to the facial structures too. So, what can these be? This kind of an abnormal head shape can occur in about 1 in every 60 newborn children. But we need not worry about 97% of these, as they are simply because of the molding of the soft bone in an infant. And these are known as positional or deformational plagiocephaly. These can be present even at birth in cases of multiple pregnancies like triplets or twins, when the water content in the uterus is very low, as in oligohydramnios, or in cases of an abnormality in the uterus, or even in cases of preterm children birth. But the majority of these develop within the first month of life after the child is taken from the hospital to home because of some certain lacuna in the strategies of positioning. But the remaining 3% might be problematic. They can be because of early fusion of the bone plate sutures, and this is called as Craniosynostosis. This condition can restrict the brain growth, and these require early surgery, ideally before 9 months of age. Generally, these abnormal head shapes are noticed by the parents, the family, or the pediatrician. As mentioned earlier, about 97% of these conditions are identified as positional plagiocephaly, and the surgeon or their staff will simply teach the parents on strategic positioning of the head. Even with these positioning strategies, by 1 year, almost all of these heads return to near normalcy. Helmets are never needed even in this condition. In this regard, especially in the famous South Indian cloth hammock, or the famously called totil or dooli, is a fantastic, safe and an excellent way to prevent as well as to correct these kind of deformities in children. The basic logic of positional correction is not to allow the child to lie on a hard surface on the flat part of its head. But if a craniosynostosis is suspected, an imaging might be done and a surgery might be offered. In about 75% of the cases, only one suture is involved, and these can be operated endoscopically. Endoscopic surgery can be done only in the first 2 to 3 months of life, but if this window of opportunity is missed, then an open surgery can be done between 6 to 9 months of life. The endoscopic surgery is simple, safe, has a very small incision, needs no ICU stay, and probably requires just 1 day of admission in the hospital. But this requires further helmet therapy for at least 1 year, and the correction of the head shape occurs gradually over the next 6 months, driven by the brain growth. If it is open surgery, it is obviously a larger incision. There is more blood loss, at least 2 days of hospital stay, which might include ICU stay. However, both are actually very safe. But usually, if more than one suture is involved, that is fused, the child might present with raised intracranial pressure or high brain pressure, and an open surgery is offered on an urgent basis. Whatever the procedure is, an early surgery ensures the optimal brain development. Beyond 1 to 2 years of age, doing a craniosynostosis surgery is merely for cosmetic reasons, and it cannot help in the brain development. So as a take-home message, whenever you encounter an abnormally shaped head in an infant, please consult a neurosurgeon immediately. In most of these cases, we are going to only teach positioning strategies and exercises, and these things will be naturally corrected. However, if it is indeed a craniosynostosis, we cannot miss this window of opportunity. We have to evaluate even within the first month of life, so that we will be able to offer the surgery early and ensure optimal brain growth. And a total or a dooli is recommended.